Kecia Gaither. Hey, Dr. Gaither.
Hey there, Miss Jenny. How are you?
Good. You're on the air. You're a double board certified physician in OB/GYN and maternal fetal medicine. You hold a master's degree in public health. You're not accomplished at all.
Not at all, girl. Not at all.
You don't do it. You know nothing. Your experience,
No.
your expertise is both in research and professional experience, caring for women with diabetes, HIV, and obesity and pregnancy. I love this. I love this conversation because as a mother of two teenagers, having been pregnant with both of them, and having gone through, I was overweight when I got pregnant with both of them. My OB/GYN totally fat shamed me with my son, and then I wrote him a letter when I got pregnant with my daughter and said, I cannot do this again if you're going to make me feel awful again. And he didn't. It was okay. So, and he's still my doctor. We worked through it. But how often does this happen, Dr. Gaither, that you get women who come to you already battling their weight, and then pregnancy just sort of exacerbates it? And what are the risks?
Well, I will say that in my career thus far, the bulk of the patients that I see are overweight to morbidly obese. That's the new norm.
Wow.
When I first started out in my training, you didn't see that so much. But at this point now, practically all of the patients, that are had, have a little weight problem. Now, as far as being heavy and being pregnant, a whole host of things that you're potentially at risk for, certainly gestational diabetes, high blood pressure during the course of your pregnancy. You're at increased risk of having certain fetal anomalies, specifically anomalies along the baby's brain and spinal cord. Increased risk of having a very large baby, having something known as shoulder dystocia. If the baby is very large, the head will come out, but the shoulders and the rest of the body won't, which obviously is a problem.
Yep.
Increased risk of C-section, increased risk of post-operative complications. So there's a whole host of things that potentially can happen, which, can kind of be ameliorated if mommy loses a little bit of weight prior to even conceiving. And
how much weight? So what are the recommendations now in terms of the weight gain and sort of what is the higher end of what's okay when you're pregnant?
Well, I don't think anybody wishes to have a specific guideline pre-pregnancy. I think it probably is best that you initiate, a change in your eating habits, a change in your exercise pattern. It would be helpful if the woman is morbidly obese to enlist the assistance of a dietitian, as well as perhaps an exercise physiologist. And I specifically say an exercise physiologist simply because, when we talk about being overweight, we talk about BMI, and a BMI is the body mass index, and that's a relation of your height versus your weight. But it doesn't take into account, the amount of actual fat that you have on your body.
Sure.
So by having an exercise physiologist, I think that is a little bit more specific as to what you need to do to kind of increase your lean muscle mass and decrease the fat.
Right, which is really the ultimate goal, because you could be skinny fat and you could be muscular, not exactly as fat as your BMI is trying to say you are.
Exactly.
Yeah.
You're all muscle as opposed to all fat. And and in and of itself, obesity increases your risk of being infertile as well. So if you do get pregnant, I've talked about the possibility of all of the adverse effects that can happen with being overweight and pregnant. But in and of itself, being heavy increases your risk of having infertility as well.
But Dr. Gaither, what are we supposed to do? I mean, look, I do Weight Wednesday every week because this is my struggle as well as my listeners' struggles. I'm not fat now. I was fat then. It's still every day an effort to be at a healthy weight for my body. And but it's always been a struggle. And like so many of my listeners, even when I was really overweight, it wasn't that I was eating bonbons all day long.